Some of you may be aware, everyone in the room is, that we're being gifted with the ongoing unpacking of Shantideva's Guide to the Bodhisattva's Way of Life, or engaging in the Bodhisattva deeds. So Venerable Children has been teaching on that, and now Venerable Sangye Kadro has been doing a review. And I'm sure you're having similar thoughts and feelings like I've been having the whole time, that it would be so wonderful to have even the beginning level of some of these qualities. Even to have the qualities of a Bodhisattva that's entered the path of accumulation, that alone would be astounding. To see any living being and to have this spontaneous feeling of love and compassion, no critical mind at all, and have that mind for poisonous snakes, for poisonous spiders. I'm the most afraid of cougars, I have to say. That will be the litmus test for me in future lives, to have a cougar walk in front of me and just have this love and affection. That's a long ways off. So before even that, though, we're learning these two methods to cultivate bodhicitta. And even before those two methods, there's just cultivating equanimity. And that alone is a deep realization that I myself had not yet developed either. But I can highly recommend this book. So if you're interested in learning more about how to practice these two methods, there's this marvelous resource called Transforming Adversity into Joy and Courage by Khenchen Geshe Jampa Tegchok. Chapter 11 is brilliant. And when you start looking at this, well, it seems so, not so hard to cultivate equanimity. What's the big problem there until you start looking at your mind all day long? And sure enough, that also is a long way off. So now I'm narrowing the focus here into what can we actually do that are bodhisattva-like deeds with an ordinary mind. So what about right now during a global pandemic? And as I continue to read reports about what's going on in this country and around the world, my heart absolutely gets blown open by reports from doctors and nurses who continue to write about what their experience is like. I'm going to read a few quotes from different sources. And if we're going to be bodhisattvas, we want to be bodhisattvas, we can't just dwell in bliss and love and light. We have to get real about what's going on around us. And so if some of these facts are disturbing, just see it as the fact that we've got to develop fortitude. And if this is hard to hear, it's hard to hear. But not to get, totally depressed about that. So this is from CNN report, March 25th, 2020. The doctor who spoke to CNN on the condition of anonymity out of concern for his job. So this is going on, right? You speak about what's going on in your hospital and you are finished. So he described a hospital that was woefully unprepared for an influx of COVID-19 patients that started 2 weeks before then. It stretched the hospital's resources thin and led to severely ill patients, outnumbering ventilators. The doctor said, we don't have the machines, we don't have the beds. To think that we're here in New York City and this is happening, it's like a third world country type of scenario. It's mind-blowing. So that was March 25th, 2020. We're going to zoom ahead to an article that showed up a few days ago in the New York Times written by Reed Abelson. And she writes, from New Mexico to Minnesota to Florida, hospitals are teeming with record numbers of COVID patients. Staff members at smaller hospitals have had to beg larger medical centers repeatedly to take just one more. Just one more patient, please take them. But many of the bigger hospitals have sharply limited the transfers they will accept because their own hallways are filled and the wards are filled with people who are sick with COVID. Despite months of planning, though, many of the nation's hospital systems are now slammed with a staggering swell of patients, no available beds, and widening shortages of nurses and doctors. They're getting sick, or they're tired out, or they're burnt out. On any single day, some hospitals have had to turn away transfer requests for patients needing urgent care or incoming emergencies. The healthcare systems are on the verge of breaking, Dr. Michael Osterholm said, a member of the President-elect Joseph Biden's Jr.'s COVID-19 Advisory Council. The public does not realize how dire the situation is and may respond with, these people may only respond when people are dying, sitting in chairs in waiting rooms and emergency rooms for 10 hours to get a bed, and they can't find one, and they die. Now we're going to back up a few days ahead of that, November 19th. I really recommend that you watch this video that's inserted inside of this article in the New York Times. So I'm putting this link and another link into the description of this video. Please watch it. It's so compelling. It's a 1-minute long video, really concise. It's shot in black and white. They're photographs of doctors and nurses. And it's a new ad campaign featuring frontline medical workers pleading for everyone to, guess what? Mask up. So I'm going to read the text of the video. And as this video unfolds, there's this very stirring music. It's very beautiful. And these photographs, and this is the message. You've called us heroes, but heroes don't deserve this. We've fought hard to protect our communities, month after month. Our shields are worn, our resolve is being tested. Yet we press on because we truly want to see this pandemic end. We put our lives on the line daily to keep you safe. So do something for us. Wear a mask. It's really impactful. And then the text underneath this video says, we're all weary and we empathize with the desire to celebrate the holidays with family and friends. But given the serious risks, we underscore how important it is to wear masks, maintain physical distancing, and wash your hands. We put our lives on the line daily to keep you safe. So do something for us. Wear your masks. So a few days ago, a friend of ours sent another letter, and this woman works in the healthcare system. I can't tell you where. Actually, at this point, doesn't matter, but I don't want to expose her for the same reason that that doctor in New York didn't want to be identified. But now this story that she's writing about isn't just happening where she was in the spring. It's right across the United States of America. And it's happening in Canada, and it's happening around the world in many countries. So in this letter that she wrote, she says this: I write with an update from the COVID front lines and ask the Abbey to continue to pray for the frontline workers in this country and throughout the world. The increase in COVID cases here is becoming more alarming day by day. Hospitals in this state and states around us, across the country, have full beds, and they're calling hospitals here to see if they can transfer patients to us. Unfortunately, our hospital beds are full too, so we can't accept them. Last week, we had a critical care patient in her 60s die in ER, one of our rural hospitals, because staff could not find an ICU bed for her anywhere. She didn't die with COVID, but she died probably because of it. She had been in the ER for 18 hours when she died. There's a very interesting video, and this link is going to go into the description as well. And it's a video made by a science and technology entertainment web series, and they call themselves the Slow-Mo Guys. So there's this one where they interview Dr. Anthony Fauci. And the film footage starts off with one of the people in this group coughing and sneezing, and they capture this in slow motion. And these segments of the video are shot at 1,000 frames per second in 4K. So he sneezes, he coughs, and then he does this very interesting thing. He's at a medium loud tone of voice. He's not shouting, but he just does this. 1, 2, 3, 4. So I'll just do a little gesturing here. 1, that's particles coming out of his mouth. 2, 3, 4, there's this explosion. 4, there's more spit and gob and stuff coming out of our mouths. It's really impactful. So you'll see this when you look at the video. We're going to look at it after lunch today. And then they show this in this video to Dr. Fauci. And, he's really impressed with this. He said, quote unquote, "This is a graphically beautiful demonstration of the importance of wearing masks and face coverings because," he says, "one of the reasons it's so important to wear a face mask covering is that we now know that 40 to 45% of people who are infected absolutely don't have any symptoms. They have the virus in their nasal pharynx, and people have an incorrect interpretation that the only time you transmit the virus is when you're coughing and sneezing and spitting all over someone." And he says that's absolutely not true. What people don't want to get, or maybe we can't appreciate, that is even if we're talking and speaking, we're spewing particles that go off in the air. Some of the heavier ones go down to the ground, and that's why they recommend social distancing of at least 6 feet. And other particles stay suspended. They're tiny, they're different sizes. You'll see it in the video for quite some time. So it's very impactful. Try and watch it. Dr. Robert Redfield, the head of the Center for Disease Control and Prevention, said on this past Wednesday that the next few months are going to be the toughest of the entire pandemic, perhaps the most difficult time in the nation's public health history. He says, we're not defenseless. The truth is that mitigation works. But it's not going to work if half of us do what we need to do. And it probably won't work if 3/4 of us do what we need to do. It has to be everybody. So I found some quotes from people that were doing different things before Thanksgiving this year. And now we know Christmas is coming up, and we know that there's a spike upon a spike because of people visiting families over Thanksgiving. And these are some quotes of what people chose to do instead of gathering at home with their friends and family. So these are great. Maybe I'll read 3 or 4 of them. So this woman writes, "My parents, who are 78 and 81, live in Canada. I haven't seen them in a year. To keep everyone safe, I won't be going home for Thanksgiving or Christmas. Because I can't be there, I had a life-size cardboard cutout of me made, and I sent it to my parents. And now that's ridiculous and silly," she writes, "but I know it'll bring a smile to my mom's face." And then another one writes, "I'll be at work in our ICU over the holidays. We'll be short-staffed again because of the growing numbers. I'll be having Thanksgiving," so this is when she was writing, "with my work family, hoping that we'll have a chance to eat." And the last person, "Have any of these remember this one? I'm skipping it. I'm skipping the holidays. I'm not going home. No risk, no harm. No one gets sick. No one dies. No one grieves. Better apart than under. I respect and love my family enough to remain apart so that we are able to enjoy many more years of celebrations." So, wearing a mask has nothing to do with politics. It has nothing to do with politics. It's a proven way of, stopping the transmission of a virus that's infecting people at alarming numbers. And so, look, putting it on, you don't have to be a Bodhisattva. Look, it's easy. You keep one in your pocket. We've got a pocket on our shirt here. So just doing this, we're protecting life, ours and those all around us. And we're creating a habit which is going to be creating tremendous merit. And that merit will allow us to realize equanimity in time and all the other practices that lead to full awakening. And this is an act of kindness. Let's not forget that. It's an act of kindness. It combats the self-centered thought. It temporarily banishes arrogance. And it's a huge symbol that says clearly, I care about you.